Hello everyone, this is Taylor and Felice, and this is our presentation on the herpes simplex virus vaccine. The herpes simplex virus, also called HSV, is a viral infection. It is defined as a virus causing contagious sores, most often around the mouth or on the genitals. The most common types are cold sores and genital herpes. HSV, there are two types, HSV1 and HSV2. HSV1 causes mucocutaneous herpes, usually in the form of perioral blisters, also called fever blisters or cold sores. This is known as oral herpes. HSV2 causes genital herpes, which look like blisters on male and female genitalia. Both of these can become serious and life-threatening. They are highly transmissible through close physical contact. The lesions are painful and occur intermittently, meaning that there are periods of latency or dormancy where there are no symptoms or sores between outbreaks. Patients may be prescribed antiviral drugs during breakouts or in between breakouts. However, there is a vaccine to prevent the herpes virus called herpes simplex vaccine.
Okay, so the herpes simplex virus vaccine is a prophylactic treatment. They may prevent or treat symptoms of HSV infection, and it should be given prior to exposure to prevent the infection. Vaccine is encouraged by the World Health Organization due to the large number of infections worldwide in efforts to control and eliminate the virus. Some prevention prevents HSV infection, prevents viral latency, reactivation, and transmission. Mother to the child transmission and neonates herpes, interactions between HSV and HIV, and it also prevents genital ulcer disease. The vaccine schedule, one single dose is usually accepted for most populations. 2 or 3 doses may be necessary for longer lasting effects, and there's also booster vaccines that can be given annually depending on circumstances. Some nursing considerations, assessments, and health history. You would want to ask the patient their sexual history and activity, do skin assessments, note any signs and symptoms, and whether they are a good candidate for the vaccine or if they are a high risk for developing HSV based on history and their sexual activity. Vaccine importance and significance. Healthcare provider will let you know what they recommend for the schedule of vaccine. There will be flu-like symptoms, soreness at the vaccination site for the first couple of days. If you experience a rash or other signs of allergic reactions, go to the hospital or notify your healthcare immediately. Vaccine administration. Here are some keynotes for your vaccine. Store the vaccine in the refrigerator until ready to administer. Generally administer IM in the deltoid region of the upper arm.
And that wraps up our presentation. Thank you so much.